Good morning, everybody, and welcome to today's forum. Thank you for joining us for our biweekly forum. We're excited to host this important conversation today on racial injustice in the food system, and we're happy that you've all taken time out of your day to join us. We meet here every Thursday from 11 a.m. To 12:15 p.m. every other Thursday, although some of our speakers may stay afterwards if they can to talk a little bit more. So out of caution during the pandemic, we've moved our forum to this online webinar format in order to promote public safety and make our forums more accessible. And before we get started with the forum today, I just want to relay a few notes about this new format that we feel you should be aware of. So everyone on except the forum presenters and support staff of the forum are muted in terms of audio and video. So don't worry about having to mute yourself or deal with any video settings. No one will be able to hear or see anyone except our speakers. Also, the chat feature is disabled for this webinar, but we encourage you to make use of the Q&A button to ask your questions or raise concerns about the webinar. Someone from the forum staff will be monitoring Q&A throughout the presentation and will help with any problems with the webinar. And we'll collect questions to ask presenters when it comes time for Q&A after their presentation. Finally, this webinar is being recorded so that we can make it available through our social media and to our registered participants afterwards. Though no one except the presenters are going to be recorded, we want to make sure everyone is aware ahead of time, just for the sake of transparency. So with all that out of the way, today we are pleased to be joined by Dr. Jill Clark from the Glenn College Public Affairs. And I'm excited to hear her talking about racial injustice and sort of rooting out racial injustice in the food system. And I will turn it over to Dr. Clark to further introduce herself and her work.
Thank you so much, Kip. I appreciate the introduction and the opportunity to be here and to be part of this forum. Jill Clark, I'm an associate professor, and I do a lot of work at the interface of public participation and food policy, food governance. And so today, and I'm just going to bring up my slides here. I'm going to talk to you about an ongoing project that's taking place in Cleveland. And this talk is going to be a little bit different because in my introduction, you notice I mentioned public participation and food policy, food governance. I'm not someone who studies systems dynamics. And so what I'm going to talk to you about is what we learned about systems dynamic as a team, and this is our team here, our community university research team, what we learned over the course of 3 years. This team is, by the way, Food Nest 2.0. It's modeling the future of food in your neighborhood. And we got together to develop strategies to help decision makers around efforts to make the food system in Cleveland more just. And I'm going to talk to you a little bit about, why we selected this approach, who participated, how we were involved, and what we produced. And really the aim is to share our practice insights on how to identify injustice. And we do it in the context of the food system, but these lessons I think would apply in pretty much any complex system. And before, one of the things I should note is that while I don't have, this isn't a singular like research paper I'm presenting, I am drawing off from the work of the team that you just saw the image of earlier, and primarily these 4 papers, and I put the lead authors here as well. And I also want to recognize these are our team members. These are contributors to this presentation. They're co-authors, and this is and I'll talk a little bit about what a core modeling team is in a moment, but essentially you can think about, this is the group that did the work. We designed, facilitated, and participated in group model building that comprises the community-based systems modeling process. And I'll get to that in a moment. But before that, I want to just give you some motivation as to why we were doing the work that we were doing. The community core modeling team is based in Cleveland. And Cleveland is one of the largest urban agriculture cities in the country, with one of the oldest and most successful food policy coalitions. However, nearly 2 out of 3 Clevelanders live in neighborhoods that experience extensive inequities in economic opportunity, health status, lack access to full service supermarkets, which tend to offer a greater variety, lower priced set of foods. So the core modeling team was interested in advancing economic opportunity, food security, and nutrition equity. And we were focused in 4 neighborhoods in Cleveland. And, I was thinking about this as I was putting this talk together. We actually selected these neighborhoods in part from the work that was done by Kerwin and some time ago on redlining. I think it was Dr. Reese and some colleagues some years ago doing that work. And so we ended up as a team, Central, Huff, St. Clair, Superior, Woodland Hills, if you're familiar with Cleveland. This is on the east side. And we have members of our core modeling team that live and organize in these neighborhoods, in addition to others. So at the time, when we were writing our proposals, and I do have a list of funders at the end, but when we were writing our proposals, there was investments of over $20 million in these neighborhoods in the food system, okay? Just those 4 neighborhoods. So investments in food-related businesses. And this is an image from the Plain Dealer of what was a proposed food hub. Strategies, there was investments in strategies to promote sales of fresh and healthy foods. And so we can think about either our social marketing campaigns, like Celebrate Your Plate, or incentives, like if you're familiar with double up programs, produce perks. It's where if you are using SNAP or WIC benefits to purchase items at a farmer's market, you can double your purchasing power, usually up to somewhere between $10 and $15 a visit. All of this is going on, and yet we have not seen the system tip towards fairness. And so it's not to suggest that these efforts were not valiant efforts. Actually, our core modeling team members are directly involved. We have members involved in each one of these efforts, but we universally agreed that we needed a different way of thinking about change in the food system. A food system works as it's designed. If you try and tinker with it, it wants to move back to a stable state. It's really stubborn that way. You hear people say, oh, you can't beat the system, or you're up against the system. And there's a lot of truth in that. So why not use systems theory to try and understand how to shift the system? Systems theory does not necessarily bring new information so much as it imparts a new way of knowing, a new way of thinking. I'm just going to kind of digress here for a second and give you an example of around a conversation that we had as a team. So for example, we talked about, adding one new supermarket to a neighborhood doesn't shift the dynamics that produce racialized patterns of food retail development across neighborhoods. And we had discussions around, using the term like food apartheid versus food desert, which you might be familiar with. Because the former term really starts to unveil the complexity and the long-term effects of racialized structures that shape food system dynamics. And this is just a little example of the shift in thinking and knowing, and even the language that we use as a core modeling team in our work. So a complex system is a group of interacting, interrelated, or interdependent parts that create a complex and unified whole that has a specific purpose, like a food system. And as I mentioned earlier, a system tries to maintain stability through feedbacks. And so I'll give you just a simple example of a system and feedbacks. So if you think about your body as a system, you like to be around 98.6 degrees, or oddly for me, when I was taking my temperature early COVID, I was always like around 97.2. I'm not sure why. But anyway, so your body likes to be at a certain temperature, and you go for a run. and the exertion warms your body beyond the desired temperature. Okay, that is feedback information to your body, and this change changes in your body activates your sweat glands until the cooling effect of perspiration readjusts your temperature back to normal. So the system is working as designed. And I remember we were talking about the food system and what it's designed to do. And one of our core modeling team members said, "You get what you get." And I just thought that was like a nice way. And you'll notice in this talk how storytelling, narrative, metaphor works throughout our group. Anyway, I'm showing you this image because this is a commonly shown image when we talk about complex systems. You know, the events are what we see, something that the system produces that we see on a daily basis. The patterns behind what we see, less so. And certainly we aren't always observing the underlying structures and rarely interrogating the mental models. So an example would be, you know, I have a cold, right? Or someone catches a cold, and that's the event. But the pattern might be noticing that someone catches a cold more often when they're tired. And the structure behind that might be the person is tired because they're working 2 to 3 contingent low-wage jobs. And the mental model behind that might be, you know, why we even have non-livable wage jobs to begin with, when for many, you know, this market reality just goes unquestioned, right? So beyond events and maybe patterns, we don't see or detect the underlying structures and mental models. And, you know, systems thinking can get us there. And as I mentioned earlier, you know, we as a team, we do have a couple of systems dynamics experts on our team, but the rest of us are not experts. And so we were really learning about how to think in this way. And I really underappreciated systems thinking until I got into it over the past 3 years of working with our core modeling team. So, you know, seeing the big picture, right? And I would argue that you really can't see the big picture unless you're doing that with a lot of other people, right? Because we have, you know, we put on a lot of blinders and have a worldview that is an additional kind of lens through which we see the world, and particular lived experiences. And so doing that by working with others. And I would say also, you know, that systems thinking, it changes your perspectives, and the way to do that perspective is also with others. We did a lot of listening to fellow core modeling team members and residents in the neighborhood. And actually we did a few public events to help like see from different perspectives, considering, you know, how mental models affect the system. We would interrogate over and over why we think things work the way they do. And if you haven't done it before, it's fun. It's pretty simple. The 5 whys, like, what's the problem? Why? Well, why? Well, why? And you continue, right, until you get to really like the underlying issues. You map variables that change over time that generate patterns, and you recognize a system structure that generates its behavior beyond the single factor. And I mentioned earlier, supermarket, like that's a single factor in a food system. Like, you use understanding of system structure to identify leverage points, or where you can make a shift in something that cascades into a larger change throughout the system. And then really focusing on the feedbacks and the circular nature. And I'll show you some of that work that we did here in a moment. All right, so we chose to bring systems thinking to the problems I described earlier. And we wanted to do this using what's called community-based systems dynamic modeling. And if you're not familiar with it, one of our core modeling team members, Peter Hovman, has written a really great and very accessible book on this that I think I have at the end for resources. Anyway, you know, we didn't want to do the modeling in the university lab, but working with this core modeling team. So I mentioned earlier, we have this core modeling team that's really doing the design, the facilitation, the participation together in group model building. Together, you know, we interrogate our mental models, like why things work the way they do. We name the pieces. We draw out the relationships between those pieces of the model, provide narratives for shared understanding. And if we were in a room right now, I'd probably ask you like, okay, who here, like who knows about community-based systems dynamic modeling? And then I could pick on you later if we got a stock and flow question. Anyway, okay, so I mentioned earlier, so this is our core modeling team. We have folks from along the supply chain. So people involved in urban agriculture, people involved in food distribution and food waste management. We've got people who are representatives of the local food bank, dietetic departments at local hospitals, community activists and organizers residing in neighborhoods, community organizations that focus on foods. And one thing I do want to note is all CMT members were compensated for their time dedicated to the project, because it was a lot of time to dedicate to this project over the course of 3 years. And they were compensated either by their employers to engage. So for instance, like think about someone from the dietetics department at a hospital, or they were compensated directly from the project grant. So if you weren't there in your professional work capacity and getting compensated in an agreement with your organization, you were paid through the project. Our overall approach is what Darcy Friedman, who's the principal investigator at Case Western, she describes our approach as deliberative and situated. Now, for those of you who might be, you use grounded theory, think about that as like being a situated approach. We use a wide array of data and perspectives, working together in place to map out ourselves and the system to gain insight, not a priori coming in with, or at least deliberately coming in. I mean, we all come to problems with our own kind of assumptions, but we didn't a priori come to the research with, like this is how we're going to see the food system. This is how it's going to work. Deliberative. The core modeling team committed approximately 60 hours per year to this process. And we had a commitment to process. So if you're not a process person, you might have had a tough time, because we had a commitment to process of listening, of inquiry, of reflection, and really of democratizing research. This was built on kind of a robust foundation of robust engagement. And this included things like having the opportunities to like learn about whole people. So we often come to a space and we're like legitimizing why we're at that space. But we would start meetings with what we called 5-minute fevers. And core modeling team members would get up and just talk about something that they're really excited about in their lives. And we get to learn about each other. And every meeting we would ask core modeling team members to reflect. And so maybe I would do it. Maybe it would be a student. Maybe it'd be one of our neighborhood organizers. Maybe it would be someone from public health. We tried to meet outside the university. Unfortunately, we're meeting virtually now, which actually I don't have to drive up 71 all the time, which is okay. We supported each other's events, like the winter sledding event in one of the neighborhoods, or going to a talk that someone was giving. And so there was relationship development that really underpinned this. But don't get me wrong. There was times when there was a lot of tension. As Kip would say, so Kip, if you're not familiar with his principles of inclusive and equitable engagement, Kip would say, well, you need to acknowledge it and you need to hold it. And that's something that we did when we really attempted that whenever there was uncomfortable discussion about, well, what do you mean by this? Well, I mean this, or I don't think it works that way, or my experience has been, we really tried to name and like hold that. Talking about power dynamics between, Case Western's a anchor institution in Cleveland, right? And the dynamics between like an anchor institution and nearby neighborhoods, and just really trying to hold that and engage with it. And I think that the people have held through the 3 years because we did that. We had a commitment to each other in that way. All right. So you're probably like, okay, what did you actually do? And so, we were, again, just to bring you back, we were interested in creating a model to explain food security, nutrition equity, and economic viability to impact decision-making. Whether it be, we could think about decision-making from a policy perspective, but we're also interested in, there are funders who are funding these interventions in neighborhoods. And how do you see the big picture when the food system is so complex? And how do you see the forest from the trees? This is a quote from one of the residents in the neighborhood. And how do we see the system within which all these pieces connect? And I did want to make a note. In addition to our core modeling team members, we did about, I think, somewhere between 9 months and a year into our process, really we sat together and asked, what kind of voices don't we have as part of the core modeling team? And we were lacking really three types of folks. We were lacking decision makers. We were lacking some more local business owners. And we have neighborhood organizers and residents on our core modeling team, we felt like we could have more. And instead of expanding that core modeling team beyond the picture that you saw, just because of somewhat manageability, we did intentionally go and have conversations. And so you'll see you'll see core modeling team member quotes, but you'll also see some resident quotes as we move forward. So what is bringing all the pieces together look like? So this is a take on one of how the pieces come together. And I purposely made this so you couldn't read it because I'm inviting you to step back. This is an example of the core modeling team's understanding of how the world worked when we started. This was one of our first models that we developed. It's an iterative process. We're still learning. But we hope that this process and modeling gives us a deeper understanding of the system and possibilities for change, because the problem is not a lack of food. The world produces enough food for everyone to eat more than once, but rather the problem is unjust and deeply rooted forces that create the system we experience. All right, so where do we start? We started by talking about what do we want to see more of and what do we want to see less of. And so Heather here was saying, hey, I want to see more healthy neighborhoods incorporating access to fresh fruits and veggies, support for local jobs, community engagement, and public art. And she wanted to see less of, residents shouldn't have to choose between packaged food and fast food without easy access to fresh and healthy food. So we would do these exercises. And by the way, I have a link later on to resources where there's a Scriptopedia, which has a lot of instructions on how to do a lot of these exercises. Anyway, so we would use these exercises and we brainstorm variables or pieces of the food system and tell stories about what we hope to see over time. And that really helps us to start thinking about an important concept in systems thinking, which is dynamics and change. And so we could start to name the pieces that are included in the system that produces our hopes and our fears. Okay. Now, oftentimes when talking about, and Heather here is talking about healthy, unhealthy food. When we talk about healthy and unhealthy food, oftentimes immediately we start to think about like the market, right? Because we're in a market-based system here. And so we can think about 4 variables that, commonly come up, like the supply and demand for healthy food, the supply and demand for unhealthy food. And so we would take the variables that we were coming up with, and this is just an example that I'm showing you here. And we would say, okay, well, how do the variables work together? So variables, something that changes over time, those pieces, if you will, of the food system. And so as demand for healthy food in the neighborhood goes up, then the supply of healthy food in the neighborhood, would it go up or would it go down? And I'll let you answer at home. Maybe you've got a cat or a dog in the room with you. My cat is usually here. I'm hoping he doesn't cry outside the door. You can tell them what you think. So would it go up or would it go down? Well, in theory, if demand goes up, supply goes up, okay? Now, if demand goes up for healthy food, what's gonna happen to demand for unhealthy food? Well, in theory, demand for unhealthy food, I'm trying to get to the camera, would go down as demand for healthy food goes up. And as demand for unhealthy food goes down, what would supply do? Well, presumably it would go down as well. And then we start getting into kind of these feedback loops. So let me show you how we then change these kinds of sentences to causal loop diagrams. And so we'll see how successful I am. I need to bring up a program here. See if it comes up. Okay. Okay, so here we have those 4 variables that I mentioned. You can see that our supplies of healthy are low and our and demand is low, and demand and supply for unhealthy is higher. Okay, and you can see these feedback loops that I was mentioning earlier. And so a positive means that both variables go in the same direction. They're either both going up or they're both going down. And a negative is opposite. So if one goes up, the other one goes down, and vice versa. Okay, so positive and then negative. Okay, and so we can kind of play this little scenario out. Let's say, hey, let's increase demand for healthy food. Okay, so that's just a simple example, because we know if it was just about markets, then we'd have the solution to healthy food in a neighborhood. It could be solved, right? And so if I were in a room with you and we were live, I would ask you to kind of shout out some other variables that you think are related to the availability of access to healthy food in a neighborhood. I'm sure they would all be very brilliant. And they might be different than what we came up with. So these are some of the variables that we came up with that are related to access. And this list has grown and changed over time. And, new variables kept popping up, and it would get us to start talking about, because, you start with like, well, if someone needs healthy food, like maybe we just go through like our emergency food system, or maybe we incentivize through like SNAP, or what's commonly known as food stamps, right? And that would be, we would have those variables there, or maybe it would be talking about the marketplace. But what was happening is new variables were coming up that allowed us to talk about injustice and equity, particularly because they would challenge the dominant story or narrative, such as, people don't eat because they don't want to be, they don't eat healthy because they don't want to, or they don't know how to. Instead, we were seeing variables like fear of gentrification, households in crisis. And we were starting to, think about, okay, like, so how do we integrate these into causal loops, which I'll show you in a moment. But one thing I highlighted food security here. For those of you who might be more on the food side than the modeling side, or might say, like, I show food security, it depends on maybe what your experience has been, but in settings like a research setting, when you see food security, often you think, oh, well, I would define food security using the USDA's definition, and we would measure it using the validated scale from USDA. But that might be how I typically define food security when, we had, folks, when we were debating about what food security is, we were talking about self-determination and the ability to determine one's own foodways. And so again, I show you all this, I bring this up because naming variables, even in itself, there was so much deliberation about what we mean by them and how would we know, like, whether we have more or less of something. Okay, so doing this process got us here. Okay, and this is just one of our takes on the complexity of the elements of a healthy food system. You know, it's more than just supply and demand. These elements or pieces or variables are all connected, and it makes a complex whole. And just because we're not going to dive into the specifics of this model, but if you're wondering what the difference between the blue and the green, the blue are variables that were considered endogenous or coming from like within the neighborhood, and green were things that were coming from outside of the neighborhood, like SNAP funding, for instance, would be outside or exogenous. And the picture, you know, so stepping back, this picture really encourages us to ask, if we change something here, you know, what happens like over here? Are there any unintended consequences of us, you know, with wages and like SNAP eligibility, right? And so we could start to think about both the relationships between, but then also unintended consequences. And this, you know, this is another kind of element of systems thinking. And one thing we did, and I mentioned this earlier, is we started using storytelling and people's personal narratives to talk through how the system works. And so earlier I showed you those feedbacks. Those feedbacks make loops. So you can see loops. There's one, here's another. Anytime you can kind of like start with a variable and follow the arrows around. Let's see, here's another one. Here's a small one. We started talking around the loops to help us identify and describe and interrogate injustice and inequity. And this is just a selection of, we did a lot of like dialoguing around, but then we forced everybody to come up with like, and remember when I say we, I'm talking about the big we. This is the whole core modeling team to come up with tweets. And so here are some of those tweets that we came up with a couple of years ago. And you know, telling stories about the loops and particularly talking about personal narratives gave rise to us talking about how those narratives were different given the color of our skin, for example. You know, how one set of relationships in the model worked differently for me than maybe one of my Black colleagues. You know, because there's different rules of the game that are like, you know, that are underneath the system. For example, like we talked a lot about crisis and how policing in a white neighborhood, you know, works differently than in a Black neighborhood, how that might impact the level of crisis, which is one of our variables in the model. And I'm going to get back to crisis here in a moment. Another way of revealing structures that create inequity and therefore injustice can be found in looking at stubborn patterns in the models that entrench the way the system works. And I'm going to show you two. And the first one is called shifting the burden. And the basic story starts with a problem symptom. All right. So now we're looking for, again, patterns of feedback patterns in models that are archetypes of like bigger, more root problems. Okay. So the first is called shifting the burden. And with shifting the burden, the basic story starts with a problem symptom that prompts intervention to solve it. Okay, we've got food insecurity, right? The solution is obvious. People are given food, all right? And so just to bring in our systems dynamics, we've got plus signs. So that means they're moving in the same direction. As food insecurity goes up, temporary food assistance goes up. Now the other sign is negative. So as temporary food assistance go up, food insecurity goes down. Okay, oh, problem solved, we're done, all right? But there's a problem because we're only looking at the problem symptom, not its fundamental, we're not looking at the fundamental problem. So over time, and in talking with neighborhood residents and in talking with CMT members, there was temporary food assistance, which is, you can think of like either maybe like SNAP or emergency food, get people into feeling stuck. And getting stuck, which is a side effect, really, and the attention paid to this temporary food assistance, which looked like it was working, distracts us from the really fundamental solution, which is economic wellness. And with economic wellness, so getting stuck, right? Getting stuck as it increases, economic wellness goes down. As economic wellness goes down, food insecurity increases. As food insecurity increases, economic wellness goes down, and now we can start to see this problematic pattern. And without simultaneously addressing the underlying causes of food insecurity, many families were talking about getting stuck in a cycle, and the burden is shifted. The burden, instead of having conversations about, for instance, livable wages, the conversations then become about how the public and nonprofit sectors are, how they need to shoulder the burden, right? And so it just distracts us from talking about a more fundamental solution. Okay, the next one I'm going to show you is fixes that fail. And I have to credit Elizabeth Benninger, who really got us started on looking at these systems archetypes. So as our understanding of the food system, as we came together and dialogued more, variables such as crime and incarceration were included in models revealing some underlying problems. So we use fixes that fail here. A problem symptom cries out, crime, and a solution is quickly implemented, incarceration. And relief comes, but it's short term because of the unintended consequences that accumulate over a long time. The problem symptom gets worse. So I'm going to show you through personal narratives to help you understand this archetype. Okay. So crime in the neighborhood. A neighborhood resident said, we don't care about eating healthy in this neighborhood. What are you going to tell me? That I'll live longer? No one cares about that. I could walk out of here right now in this neighborhood and not be here. So for me, living longer, I don't care. You can't tell me that if I eat a fruit, I am going to live longer, because I might be laying in bed, and if the wrong person or the wrong thing comes through my house, no one lives on that. You want me to care about my body? I'm good. So really food insecurity was about, fear of one's body, right? And their life. Okay, so crime in the neighborhood. Go after criminals. Neighborhood conversations consistently highlighted safety concerns to be a key contributor to an inequitable food system. And incarceration was identified as one of the most commonly implemented solutions for addressing this problem, affecting generations of Black residents. One resident said, my whole family's been locked up on the war on drugs and probation violation and different things like that. But I mean, it's the area, we're poor. So basically it's like, once you go to prison, you get out of prison, you violate. And so it's like trauma on top of trauma. It's like peeling back an onion. There's layers of trauma that haven't even been addressed in regards to, how do I get a fresh start to get a good job? How do I take care of my family? A lot of families is born into poverty, and so they think this is normal, and it's not normal. Okay, so the fix through feedbacks creates problematic patterns that have unintended consequences. And these are delayed patterns, and you saw that earlier with the hashtags. So the solution, of addressing crime through incarceration may have initially decreased crime and promoted safety. However, it was expressed that this approach was ineffective, especially due to its impact on household poverty and its perpetuation of structural racism. One resident said, I found it hard to find work in my neighborhood, I found it hard to find work because of my background, not because of my experience. I could go out, I could ace an interview, but then when they do my background check, not. So take someone, you take someone off a job while they're not earning while in prison, and then it's difficult to get a job once they're out. Another resident was talking about how they were in a classroom, and they asked the kids, how many kids in this class raise your hand if you've got a parent that's incarcerated. And it was 25 kids in the classroom, and 19 of those kids raised their hand. Again, we used narratives to help us really understand the dynamics in the system. Those narratives came from both our team members and also from residents, and they helped us dig a bit deeper, getting into root causes. That's what archetypes are meant to do. And there are 6 other kinds. I've just shown you 2. There are archetypes around underinvestment, increasing threats, limiting success, tragedy that commons, underachievement. There might be more, but I think those are the main ones. Okay, So now we've covered at least 3 ways our team is identifying inequity in the food system. Number 1, the pieces of the variables contributing to inequity. 2, the way they come together in patterns through feedbacks, like system archetypes. And 3, developing, understanding, and interrogating narratives, particularly those that challenge or expand dominant narratives. So we, the core modeling team, that long list of names you saw at the beginning, and the picture we started with, we spent a lot of time together as a team, learning together. And I've mentioned this many times because we're still learning together. And we can still do a better job. And, I think a lot about dealing with the differences in power in the room and the differences in stake of the situation. So for instance, like, one researcher might be finding some of these conversations to be super interesting and fun, while someone's really talking about issues of life and death. And, thinking about how that works in a deliberative setting. We are still modeling together and developing metaphors to share with others. And here is a metaphor, one of my favorites, and this is from the principal investigator, and it really brings the food system, systems thinking with an equity lens together, I think. As someone new to systems thinking, I'll tell you, it's really been a challenge. I've had to almost like unlearn some ways of thinking about the world. And it's been a humbling experience. Okay, so where are we now? First, I just want to show you kind of the before and after. This is where we're at with the actual model, in case you're interested in that. There will be some more robust conversations about the specificities of the model in other talks and a paper that is being drafted right now. But what I want to use this one just to show you kind of how it's changed over time, but also because there are kind of 3 basic domains, if you will, of this model. One is kind of meeting basic food needs. It's something that, I think anyone working around issues of nutrition inequity, food insecurity, this is commonly going to be one of the responses. And because people need to eat, people need to have security in knowing that they have a next meal. But there's dignity in participating in the marketplace. We are a market-based society. There's dignity in that. But the ability to participate in that marketplace is really recognizing that economic stability is essential. And then the third domain, and this was nowhere in the model when we started, but is really kind of one of the biggest pieces that we are currently talking about, and I'll show you here in a minute what we're doing, is around community empowerment and sovereignty. Oops, there we go. And so these 3 basic domains, if you were to look under, I'm pointing, you can't see what I'm pointing at. If you were to look under each of these, you would see a bunch of loops, okay? So I want to show you the loops that are related to each of those. So here's our basic domains. Here are the loops, at least what we've called them, what we've titled them. These are what gives rise to thinking about leverage points, and that'll be my final concept that I get to. Leverage points for food system change is, as I mentioned earlier, food system is always trying to go back to the way it operates because that's what it's designed to do. But most changes are focused on a single variable or piece of the system. Like, we just need to put fruits and vegetables in a corner store. We just need more healthy food at a food bank. But to be more effective, and this is needed, don't get me wrong, but to be more effective for systems change, we need to start digging a little bit deeper and think about maybe changing a link between variables. So the link between stigma and access to benefits, or employment and criminal record. But to be even more oriented towards systems change, we need to think about changing the rules of the game, right? What about rewarding companies that have fewer people, that have more livable wages and fewer people kind of getting stuck, as I mentioned earlier? Or, incarceration isn't the first response to a crime. These are kind of the rules of the game, or the rules of the game that make it different between, as I mentioned earlier, like the my white colleagues' experiences and my Black colleagues' experiences. Or we can start to think even deeper about mental models, like, is food just a right? Does everyone deserve a livable wage job? All right, so what did system thinking do for the project? Well, we started out by talking about building on the $20 million of investment that was happening in our neighborhoods. And these were what initially that group came up with for how we could tip the system towards fairness. You recognize these, I mentioned them before. Notice that most of these are at the variable or at just the feedback level. I want to show you what it looks like now. All right, so the leverage points now really shift. It isn't about monkeying with individual parts of the system. It's more about political power, ownership, agency, self-determination. It's about household financial strength, communities owning and leading their own change, people having fair access to fresh and healthy foods, households that are healthy in mind, body, and spirit, and people having freedom, agency, and dignity over their food rituals. If you want to see, I'm going to be wrapping up here. If you want to see kind of where these landed, like in print, I've got a link in the slides later, and you can download our menu of actions, which is really just to kind of stop at some point in the project and start to share what we've been learning. And what's really fun is with this menu of actions, we have the core modeling team has decided that through Case Western, we started a fellowship program. And I want to give a shout out to 3 of our fellows, Ms. Jackson, Burns, and Boswell, who are core modeling team members, but are also fellows. These are folks who are joining in a 6-month endeavor to say, okay, we've done all this work. Now, what does this look like on the ground? And so this fellowship is really just a test kitchen. You know, working with neighborhood activists and organizers to lead change. All right, so just to review the ways that we, at least, there are probably more ways than this, but this is the 4 that I came up with in reflecting on 3 years of work. How we identified injustice in the food system was factors or variables contributing to the inequity in the system, particularly those that challenge or dominate the narrative, like, for instance, including incarceration, or variables that have different rules for different groups of people, patterns and structures, system archetypes and structures in the model, feedback loops that create problematic patterns, unintended consequences. And I think I saw a question earlier about unintended consequences. While the system is producing what it produces, like you get what you get, I think some would say the intention of alleviating crime in the neighborhood was not meant to then keep perpetuating that crime. Maybe that's a naive response, but all right, so let's see, and distracts us from fundamental solutions. Really using, developing, understanding, interrogating narratives, and really helping us to dig in deep and understanding the levels of intervention, which I just showed you. We've got a lot of lessons learned. I'm looking at my time. I'm at 45 minutes, so I'm going to wrap up super quick. You know, how do you know it's working? You started asking different kinds of questions than you were asking before. You hear catchphrases that raise cautionary flags. For example, like, well, people would eat better if they just knew how to cook that food. You start to like, wait, hold on, I'm going to challenge that narrative. You begin to detect archetypes and think about feedbacks and stories that you hear. You start to surface mental models of yours and others. There were lots of things I talked about in the process that I think worked really well. You know, starting out very simply with hopes and fears, attaching variables to those, talking about relationships, getting them into models. If we wanted to take a step further, we would start doing simulation of those models with like stock and flows. But you know, a lot of this takes time. You saw the commitment, 3 years, 60 hours per year. It takes a lot of time, and it also takes a lot of vulnerability. And this has been something that's been, you know, I've had to look back. It's been a very humbling process. You know, we had a lot of people who were part of those initiatives, right, that I mentioned earlier that gave rise to the motivation. And just humbling to talk about your own work and like how it's not making systems change. And then, I think I go back to what Kip was talking about earlier about embracing, calling out things such as calling out tensions and really kind of holding them and acknowledging them and then really dialoguing around them. When you want to make systems change, right, there's this desire to giving out more fresh produce to the food bank isn't about systems change. No, it's not, but you need both and, right? You need to address the symptoms now while working towards systems change. If you wanted a project that had a defined, defined roadmap, this is not the kind of work for you. That has been, it's been difficult for me to learn how to experiment, adapt, and learn because I'm used to having a research plan that has a research question. We're going to collect this data and we're going to come up with the answer. And knowing when to stop, because our understanding is always evolving, at some point you have to just stop. Okay, this work was made possible by these wonderful folks. Mostly our largest funder is the Foundation for Food and Ag. I can send, if you send me an email, I can send you these resources that I mentioned. Here's my email address. Happy to also send you the slides or provide them to the Kirwan Institute and they can share them. Okay, with that, I'm going to invite Kip back on to help me kind of get into some of these questions I saw popping up.
Sure. Well, thank you, Jill. This has been wonderful, a wonderful presentation. I love hearing, I'm a systems junkie myself, so this was just fun for me. Really speaks to a lot of things that we talk about in terms of addressing structural barriers to race at Kirwan and how it really is about looking at the whole system in very different ways. So we got a few questions so far. I want to just remind everybody, if you have a question for Dr. Clark, feel free to put that in the Q&A and I'll sort of queue those up and answer those as we go along for our remaining time. May not get to all of them depending on how many questions, but we'll just kind of go through and see where we get and see how we get. So I'll go with a question that was asked earlier in the presentation. Really, first of all, somebody just praising you for your work and your approach, and they appreciate that you paid everyone. That sometimes does not happen, so that was very appreciated. And their question was, who was willing to fund this kind of project, and what those funders saw as a value proposition in that investment, and why they see this approach as being the best in.
That's a great question. And if we had our PI, Darcy Friedman, who really was the force behind organizing all of the funders. So I think I mentioned, let's see, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 main funders. And then if you think about all the organizations that paid the folks that did get paid through their organization, they are also funders. It started with the Foundation for Food and Agriculture Research, which is funded through the Farm Bill. It's like, it's quasi public funding that comes through the Farm Bill. And they were interested in doing something really bold and jumping into complex systems modeling, and ended up funding, oh boy, I'm gonna get this wrong. It's about 5 projects, give or take one. We chose to do a community-based systems dynamic modeling project, which was a bit different than some of the others. And so to answer your question, they were really wanting to be bold in some of their initial funding. This was some of the initial funding they were doing. They also require 100 an equal cash match. So $1 million to $1 million, right? And so it really, you'll notice that the other funders are some funders that are based in Cleveland who've been working in this space, who funded some of those projects I mentioned earlier that really weren't tipping the systems towards fairness, right? And so it's like, okay, well, how do we understand how what we're funding here works with what's over here? And so that's another type of funder. And then all the institutions, the research institutions, so like the Glenn College, the Albert Einstein College, there were a few of us that are not in Cleveland that are part of this. Our systems dynamic modeling expert is not, he's at the Albert Einstein College. Our college has also put in some salary. And so you're right, this is not, I've got this research question and now I'm going to answer it kind of funding. But I think the deep embeddedness of the community foundations in this work, and the boldness of that, we were able to bring those two together.
Awesome. Yeah, thank you for that. The next question is about how was the group prepared to have a common understanding around the racial construct in America?
That's a good question. Oh gosh, it's been so long since we've been together, and I'm thinking back, and so I'm trying to think if we did any kind of more like specialized training, but I don't think we did. I think that our learning came because we were dialoguing with one another. And if you were to look at our agendas, again, I mentioned, if you're not a process person, like this would have been probably difficult for you. A lot of it was getting to know each other, and getting to know all the work that had been done, like what we were building on. Some people came into this space already having been doing work in these neighborhoods for a really long time. I'm a bit unusual as a core modeling team member because I'm coming from Columbus, and my colleague from Albert Einstein. Most of the folks there kind of live, work, pray, play kind of in those spaces being that east side of Cleveland. And so, I don't know if they had done any pre-work prior, but as a core modeling team, I would say our learning really came kind of the learning was between everyone.
Yeah. Well, I mean, kind of goes into this next question too. Was there an understanding of poverty established through specific exercises, say like community action poverty simulation or anything like that, or was it more informal? Do you think?
It was more, well, there was three answers to that. One, there was a point in time where we did realize, looking around the room, that things were starting to come up in conversation that we felt like we need to hear from more people. And so we actually did have conversations with neighbors. Gosh, I want to say it was upwards of at least 40, maybe. And that's I mentioned that we at one point stopped and said, who's not here? Decision makers, we had conversations with them. Food business, local business owners, and more neighbors, because while we had neighbors involved, they were limited. So part of it was actually systematically having conversations. These were identified, who's kind of not here was systematically identified, and then we went out and met people. This is when we could still meet live, and our team had conversation and would come back and really share those conversations with the broader team. So that's one way. The other answer that I have is that we didn't do anything formal, because I'll tell you, we were all grappling with how to think to systems thinking. So, what's a causal loop model? How do you sign the variables? I'll tell you that one of the most challenging ones was what should be in the model, what should be out of the model, like really drawing boundaries. So I had a small training in systems dynamic modeling, and our PI had a little bit more training, and then we had the expert from Einstein, David Lansbury, so we were all as a team grappling with how to do systems dynamic modeling in a deliberative way. And honestly, that was all of our formal training was around that. But you're making me think, yeah, we didn't do anything like that simulator.
Yeah. I mean, it really does sound like it was kind of an emerging sort of model of really kind of coming to a way of being able to discuss and talk, and like you were talking about, co-learn about one another, and poverty, and sort of the concepts around racial injustice and things like that. As you went in that way.
Mm-hmm. Yeah, it is. I wish almost that I had been keeping a diary from the very beginning to kind of watch the evolution of myself. I mean, as someone who this has been, again, pretty challenging for me, because we're taught to be like, you're an expert, right? You show up, there's a research question, you design a way to answer that, right? And that's not what this project was about. It's been one of the most rewarding things. And if you look at our core modeling team after 3 years, we did have a couple folks that did leave, but that was due to a change in job. But essentially, there have been some slight changes, and we did end up bringing on a couple more neighbors when we did a public event. But through and through, it's a fairly consistent group that has kind of embraced this vagueness in what we were doing, because we were all just so deep in the learning together.
Yeah, that sounds awesome. Well, I'll go on to this next question. It kind of goes out from the group and just talks about the project more in general. Someone asked if there were nuances in how culture affected people's perception of food access and education. And I think you talked a little bit about that in the presentation. And so I think, if there's anything you had to add in that way, it would be great.
Mm-hmm. Yeah, absolutely. So there were definitely different perspectives. And this is where, really understanding the whole cannot be done on one's own, especially for people who have been maybe, I think if we wanted to kind of like, let's just immediately separate two groups out, okay? And I hate to make divisions in our core modeling team, but let's just separate out the folks that have had lived experiences from those who have not, okay? And then from those that have lived experiences with lack of access, we can separate those folks from those that have never really talked to people about lack of access from those who have. And then there's folks that come from more of like a market-based perspective. So you're training, right? We can start to separate people out from like where their expertise comes from, right? Which is, I guess, where I started, which is like your lived experience expertise, whether or not you do like healthy food retailing from a market perspective. That's why I started with supply and demand, because that's where I used to do some healthy retailing work. That's where people would start, is supply and demand. Absolutely. And that was really hashed out. I mean, I could show you photos of like, if you're not a dots person or like a person who likes, like, we would sticky notes and drawings, and we would have this room filled of like, kind of, I want to challenge you on how this works. Well, I want to elaborate on how this works. And so absolutely there was this, so what we see today in this project is really this convergence, because where we started, even as a team, so when I showed you what we were working on initially as a team, okay, we even started as a team in a very different place. So even with all of those different expertise, they hadn't come together until now what you see today, which is really about, the marketplace is relevant. It's always going to be relevant. We're in a market-based society, right? We can try and talk about how we don't like that. We can talk about how we want to push against that, but it is a reality, right? We also live in it. We also have a system where people need to be fed now, right? They need access now. And so that those basic needs are going to need to be met. But our area of around like political power and empowerment and ownership is really what's kind of blown out, and where most of our fellows are working right now. And so we have the same people we've been having conversations with, but you can see how we went from meeting basic needs in market to a whole different picture.
Yeah. That is a lot of food for thought. I love that sort of wide version of, not only in a personal and interpersonal, but also from a systems standpoint of looking at that question. So thank you. So I have another question here. That is someone who joined a little bit late, but they wanted to know if you, or anyone was looking at a link between foods that are well known to cause modifications in behavior and other issues, specifically like gluten that is known to trigger irritability, aggressiveness, and dairy that can cause irritability, depression, and anxiousness. So is there any sort of discussion of the food effects on sort of brain chemistry or behavior or anything like that?
That's a really interesting question. And I'll tell you why we did it. Although I'd love to, this is something I would love to hear more about. One of the things that we really struggled with was the boundaries of the project. Part of the boundaries were set by kind of like what is within the neighborhoods in the system, what's outside, that's part of the boundaries. Other set of boundaries, which really were tough for us to like internalize, was we were really talking about the neighborhood and level and households making up that neighborhood, but we really resisted trying to get to individuals and like individual biophysiology. I mean, that's even a word. I might have just made that up. I don't know. And so we were always trying, because we weren't working. You could start to see how we could have been talking about the city, but we weren't. We were talking about the neighborhood, and then just under that, like households. But really, we resisted individuals because our models would have just looked really different. And what we were trying to do is inform decision makers. So like elected ward members in Cleveland and other decision makers and funders. And so we really wanted to keep the focus kind of at the neighborhood level. So great question. It's just part of that, putting the boundaries on what we did.
Right. I think that is so important, when you're dealing with a problem such as food injustice and food inequality, and looking at it from a lens. There are a lot of different things you can look at, right? Mm-hmm. And it's really about kind of, creating that focus, around, a topic that you can really describe and really take hold of from your expertise, I think is a big part of that.
Mm-hmm. Yeah, and by the way, I just want to add something to the question earlier about, did we do any training? It wasn't all totally emergent. There were times when, for example, I mentioned early on in the talk, I've always had an aversion to the word food desert for lots of reasons, and we can talk about why that is. But at points in time when things would surface that people didn't really know how to hold on to, using Kip's language. Someone from the core modeling team, it could be like Darcy, who's the lead, or it could be one of our members. I believe it was Ms. Boswell, one of our neighborhood organizer activists, that brought forth an article, a really short piece about food apartheid. And we all read it, we committed to reading it. And the next time we came in, we talked about that piece and what it meant. And so again, not formal training, but there was just this real desire to learn together, right? And not and learn as a team, rather than necessarily bringing out an outside kind of curriculum to bear. And that might be right or wrong, I'm not sure, but we did have those stopping points where we would deliberately talk about an issue. Like, for instance, we just did a book club around kind of the experience of Black farming in the United States, and having a robust conversation around that. And so there were these points in time where we'd say, okay, we dove into the relief package recently to look at what was happening along the sweep things, to talk about how equity and historic inequity was being addressed in the relief package.
Fantastic. Yeah, another question came through while we were talking about that. Someone asked, can you share more on the marketing and cultural views of where, when, and how individuals purchase fresh foods?
Mm-hmm. Oh gosh, and yes, Fresh Foods Here. I'm familiar with Fresh Foods Here. So Fresh Foods Here was is an initiative. It's called like a healthy corner store initiative, right? And that's kind of the general term. It's thinking about, and actually this was a equivalent, she's referencing a project that has like an equivalent even in the neighborhoods we were in. And the model is you bring, I'm thinking about a neighborhood here, Franklinton. There's like 32 places to get food and not one of them's a grocery store. Why do we care about grocery stores? Quickly again, we care about grocery stores because greatest variety, lowest prices. Okay. Anyway, so let's see, the question is about marketing culture. So it's a good question. We so quickly got away from marketing through our dialogue and started to get into what are the other factors that a household's dealing with that makes it difficult to focus on food. So some of the example I brought up earlier was, around crime. It's like, hey, eating fruits and vegetables, like when I'm worried about stepping outside of my house and potentially, or somebody coming in my window, that was the other part of that quote that I read. I've got a list of priorities, and like fruits and vegetables, like that would be great to have that as a priority. I'd love to be in a situation where those could be a priority for me. And it's because of, that's just one example, but we talked about other types of crisis. We talked about acute crisis, long burning crisis. We talked about COVID, of course. We quickly got away from marketing. Now, if you look at our model, willingness to pay is in the model. So going to your question about, would people be willing to pay for fresh and healthy items is still part of our model. It's informed by lots of things, including cultural views. We didn't really dig into those because we know that people have different food ways. But it was almost like there were these things that kept coming up that were just higher priority and that were more meaningful, that were getting into people's decisions about food to begin with versus like whether or not they're going to, buy this particular piece of fruit or not. I don't know if that answers your question. I hope it does. But it's just like the energy just wasn't as much around marketing and cultural views around food. They're in the model, but you don't see a whole lot about that even in our menu of potential actions.
Mm-hmm. As you were talking, I was thinking that's like the great paradox of this work. And I think you alluded to it earlier, is that in service of systems thinking and talking about systems thinking and acting, in a collaborative, in that kind of world, you actually have to kind of start off in a conversational space where there's a lot of flexibility to go where the energy is. So you often, you're led into these kind of situations where you come in with an ideal or a thought of like, okay, here's a problem in the system that I know about, that it's covered in research or something like that. But you get into the conversation and people are like, here's how the system is affecting me. Here are the unintended consequences that I'm dealing with. And so this is the priority. And then you're like, okay, well, I've got to switch to really understand like sort of where the pressure points of that system might be. There may be a lot of things that are in that system, but depending on who you're talking to and their food ways and their life experiences, you could be dealing with a lot of different unintended consequences.
Right. And I think it also, as you were talking, it was when it's systems thinking, we had decided early on, I'm going to go back to the response that I mentioned earlier. Marketing really starts to take on almost like we're individualizing the target, right? The target of marketing. And we really resisted making this about kind of individual behavioral change, and rather thinking about this from like a systems change. And so that would be another reason why we didn't really move as much into marketing. The other thing I wrote down was, it was about the energy, but it was also about kind of how, when your mental model of how the world works comes into conflict with someone else's mental model of how the world works, you start to like, if you're really open and you're, if you're willing to be vulnerable and have some humility, you start to like change that mental model. And I think that that's what was happening. So initially we did have culture is like a system. Like we could talk about how culture it plays a role in a broader system, but because the mental models that we were surfacing, those are and kind of coming up against each other and trying to create something new that was creating this different way of seeing what priorities. The other thing I should mention is that we did do some mathematical modeling. So the intention is also to develop mathematical models so we can actually like simulate, like if we tinker this here, what happens over here, right? And the intuition from conversation was that some of those feedbacks and some of those loops, right, would tip the system more towards fairness than others. And so that's where I go back to culture plays a role, but power, community sovereignty, ownership really is where there's been more conversation around. That could be a greater tipping point. So again, not to diminish culture, it's very important, but I think these are the reasons why it just didn't have, as you said, the energy behind it, Kip, as much as other areas.
Yeah, it's really great point. Well, I know we are a little bit past time, and I want to respect your time and the time of our participants. I wanted to thank you for a great presentation, a great Q&A session around this very important topic. We had some really great conversation in the Q&A. So I thank you once again for bringing your expertise and knowledge and sharing that with us today. I don't know if you have any final words that you want to leave the participants with, or did you say it all in the presentation?
I'm an N of one. I'm just one person, but I will tell you, it's uncomfortable to challenge the way that you think about things. And by going through this process, I'm not talking about the way I think about food, right? I'm more talking about systems thinking, the way that we think about how to understand the world. If you haven't engaged with it before, I just really put that out there as something to start to jump into. Also, you saw my email, clark.1099@osu.edu. Happy to follow up with you individually if you're interested. And Kip and the rest of the Kerwin team, thank you so much for the invitation. It's meant a lot to me. I really appreciate you allowing me to be part of this important forum that you put on.
Well, thank you too, Dr. Clark. And thank you also to the participants who joined us today and our support staff. Once again, we'll be back in a couple of weeks with our next forum at this time as well. Look out for the recording that'll be sent out to anyone who's registered for a forum. So if you've registered for a forum, you'll get the recording and an invitation to our next forum. And also look out for that recording on our social media as well, probably in the next couple of days as we cycle through. And with that, just a final thanks to you, Dr. Clark, and a final thanks to our participants. And I hope everyone has a great rest of the day and a great weekend. And we'll see you soon in a couple of weeks.